Hi everyone, we're Group 6. I'm Fernanda, and our project is about a smart cane for elderly people and their safety.
I'm Sophia Frank.
I'm Joseph Groom.
I'm Mehek Punjabi.
I'm William Rosario. The elderly population in the US is seeing a rapid rise due to increased life expectancy and the increase in birth rates when compared to the rate of death in the US. This aging population faces heightened risks such as falls, chronic illnesses, and cognitive decline such as memory loss. This population faces challenges like limited access to healthcare due to financial strain and the rising price of healthcare and treatment in the U.S. They also face social isolation, which can further exacerbate their limited access to healthcare. While many assistive technologies exist, the limited access that a large portion of the elderly population has means they can't find treatment or aid with the problems they face. Because of this, our goal is to make a legislative bill to provide support coverage to the elderly population alongside the development of an accessible fall detection cane. With this, our policy proposal aims to promote autonomy, ethical oversight, and an equitable access in elderly care. Our bill is grounded in bioethical principles and is supporting real-world case studies and research.
Our project had two main objectives. First, to design and prototype a low-cost fall detection cane for elderly and disabled users using accessible components. The idea was to make it affordable, functional, and easy to use, something that could realistically be covered by public insurance programs. Second, we aim to support this device with a legislative proposal of certified fall prevention technologies. Our goal was not just technical innovation, but policy impact, grounding everything in ethical principles to promote equitable access and improve elder care across the country.
This project aims to address three main ethical issues and a few others. The main three that we're hitting is going to be justice, autonomy, and then a combination of beneficence and non-maleficence. Obviously, with justice, with the older aging population, a lot of them are going to be retired, and we're going to have a limited income. As such, these aids that aren't covered by insurance might be something that's out of their reach if they are living from paycheck to paycheck. As such, this cane being accessible, and then also the legislative bill that has it that aims to proposes to have it covered by insurance is going to be something that will make it more accessible for everyone who needs it and not just the people who can afford it. Moving on to autonomy, of course, like most canes, it's going to allow people to move around freely and securely. It's going to allow them to have a little more autonomy and a little more comfort as they go around. But what we also aim to add more than just a regular cane is that the feeling of like safeness when they go around, they know when you're older that you have more chance of falling, and these falls can be fatal. And as such, a lot of older people try to avoid going out and doing the things that they want to do and fear that they might might fall and not get the help that they need. With this cane, we can reduce that fear from this, allowing them to do everything they want to do and increase their autonomy. And then, of course, lastly, we're going to hit that beneficence and non-maleficence. The idea here is that a lot of falls, especially an elderly population, can lead to major breaks and some poor health outcomes overall. And so if we can reduce the amount of falls with the cane, and reduce the response time required after a fall, then we can reduce some of these negative health outcomes, which is a beneficence. And then non-maleficence is the idea is that if we can do these, if we can is really what the bill aims to hit, and that if we can prevent these falls, if we can prevent these negative medical outcomes from these extra falls and from the long response time, then we should do so if we can. Going into the methods of this device, our main goals here is going to be making something that's affordable. So A, that it will be covered by health insurance, and B, even if it isn't, it's something that most people can afford. As such, our goal was trying to go with the cheapest components that we could get that does the job accurately and safely. So we ended up going with a ESP32 room, which is a microcontroller that has Bluetooth and Wi-Fi capabilities, along with a ADXL 345, which is an accelerometer, which has all 3 axes support and runs over SPI communication. Along with these, we have integrated a several wires, buttons, and in the future a battery pack to go along with it. Altogether, the devices cost about $9 with just the circuitry, and if bought in bulk, it's somewhere around $3 or $4 for everything. So this is starting off fairly cheap for just the circuitry that we need. The way that we started up with this is going to have a microcontroller. We set up using SPI from the accelerometer. The accelerometer is going to constantly output however many G's of well, any force that it feels upon it at all. When standing or just holding, you're just going to get 1 G of force that is caused from our gravitational pull downwards and nothing in any of the other directions. As such, we mounted it in the device so that on the y-axis is where where all the gravity is going to go straight down. And using these calculations, if the force that it feels drops below 0.3 Gs, it sets off an alarm that a fall is happening. On normal capacity, when you're just holding it around, you're going to end up with about 1 G. And during falls, you can hit anywhere, depending on how quickly you fall down, you can hit anywhere between like 0.1 and like 0.23 or something like that. And so anything below 0.3 was our safety threshold. Just from movements up and down that might go with your hips, you're probably only going to stay around 0.7 or 0.8 Gs. So we felt like that was a safe range to hit our detection at. Otherwise, there was also the rest of the cane that we had to design, the physical build, and that I will leave to Sophia.
Yeah, so just overall in the spirit that Joseph mentioned of being compact, low cost, and just accessible and easy to use, we designed a 3D printed cane handle that was as small as possible and comfortable with ergonomic grip to contain all the components. So it's 3D printed with PLA, so that is affordable. It didn't raise our cost by any significant means. We attached to an aluminum rod, and then we made a foot for the floor, so we wouldn't have any scraping of the floor or hitting of the individual's foot with the aluminum rod. So as for our results, after we actually assembled the device, we wanted to test it and make sure that if we are delivering a product, we need to make sure that it's actually able to deliver the goals that it's meant to, which is safety and reliability. So in the first videos, we are testing whether or not the cane is durable enough to withstand a fall, because if not, it's not going to be able to relay the important information about whether the individual has fallen or the SOS signal. And as shown in these videos, the cane was able to survive during a couple of different kinds of falls. Next, we wanted to determine in the case of a more severe fall where it would be a little bit more imminent to have those safety features on and to make sure that the cane is durable enough to survive. We tested the cane if it would be durable enough to fall down the stairs. And as shown, it was able to fall down the stairs. We experienced no cracking of any sort when we dropped it down.
And also during each of them, we got the reports that when it fell, that actually was detecting that those falls were happening, along with when they pressed the SOS button that we included with it, that we got the SOS feedback as well.
So the Elderly Mobility and Safety Accessibility Act, or the EMSA Act, was created to address critical and growing issue. Older adults, particularly those living in low-income or rural communities who face a high risk of falls. And while technology exists to help reduce that risk, many of the people who need it most simply can't afford it. So that's where the EMSA Act steps in. It ensures that certified fall prevention devices like our Smart Cane are fully covered by Medicare Part B, removing the financial barrier for those who need it most. To qualify under the Act, devices must meet a few key criteria. They must cost under $100, be designed using universal design standards so that they're accessible to people with physical or cognitive limitations, and include strict privacy protections. For example, any Bluetooth-based location tracking can only be accessed by a caregiver or healthcare provider if the user gives explicit informed consent. So this protects both privacy and autonomy. To ensure the policy stays ethical and keeps pace with future technology, the bill also establishes a National Biomedical Ethics Advisory Board, and this board would be responsible for overseeing device certifications, monitoring ethical compliance, and recommending policy updates as needed. It's a built-in safeguard to keep the program both effective and fair over time. But this bill is more than just about control, cost control. It's about ethical healthcare reform. So every year falls among seniors result in over 50 billion in healthcare costs and more than 32,000 deaths in the US, according to the CDC. So when help is delayed, those outcomes get even worse, and early detection systems like the Smart Cane can drastically reduce these risks by ensuring help gets sooner there. The EMSA Act is designed to fit into the existing Medicare durable medical equipment, the DME structure. So rather than creating a whole new system, we're improving the one that we already have. From a bioethical standpoint, this proposal is grounded in the core principles of healthcare ethics. It supports justice by targeting aid to understand populations. It upholds autonomy by helping seniors stay independent and in control of their care. It promotes beneficence and non-maleficence by preventing harm and actively improving well-being, and it protects confidentiality by ensuring users' data stays private and consent-driven.
So our team successfully built a low-cost smart cane using a ESP32 and an accelerometer to detect falls and send alerts via Bluetooth. We also proposed a legislation to support Medicare and Medicaid coverage grounded in strong ethical principles. For future improvements, we plan to add a rechargeable battery for easier and long-term use. Also create a mobile app for alerts, location tracking, and caregiver notifications. And then switch to a custom PCB for better size and durability, integrate more sensors like GPS for better accuracy, and then finally conduct real-world testing with elderly users and clinicians to improve usability.
Thank you for watching our presentation. Vote for
And vote
EMSA
yes
today.
on EMSA.
EMSA.